Good afternoon, everybody. My name is Dr. Ted Waters. I am the Director of High-Risk Pregnancy Services here at Oishei Children's Hospital. And today I was going to be presenting about pregnancy vaccination and some updated guidance for both influenza and COVID vaccination for pregnant or recently pregnant individuals. So what I'd like to just go over with everybody today, a few aims, is to review the recent guidance from the American College of Obstetricians and Gynecologists, known as ACOG, for influenza and COVID vaccination in pregnant or recently pregnant individuals. Include some updates related to the use of the bivalent updated boosters in this situation. Discuss a little bit about influenza in pregnancy and what we're seeing both locally and nationally about the flu, and also talk about some recent released information from the New York State Department of Health related to what are some identified barriers for vaccination in pregnancy. So the key recommendations that I just wanted to go over today are that it is recommended that all pregnant and lactating individuals should receive a COVID vaccine or the vaccine series, that messenger RNA and the Novavax COVID vaccines are preferred over the Johnson & Johnson vaccines for the primary series. The mRNA COVID vaccines are preferred over the J&J vaccines additionally for the booster series. And anyone 12 or older who completed an initial COVID vaccine should receive the new bivalent booster 2 months following the last primary dose or booster, including if they're after delivery. Some other information is that vaccination can be in any trimester of pregnancy, so at any time when somebody's pregnant, vaccine is an opportunity. Questions that patients or individuals have about safety should always be addressed. COVID vaccination be administered simultaneously with other vaccines, including the flu vaccine and the Tdap vaccine. Moderate to severe sick patients with an immune issue, such as those that might have been a transplant, should receive an additional dose 4 weeks after the completion of the primary series. For those people that have the mRNA vaccine, this would be 3 total doses for their primary series. And people with a recent COVID infection are eligible for vaccination once they recover from illness, and this can be delayed up to 3 months from when they were originally sick. So just to go over what are the different types of COVID vaccines that are available, the one that is most frequently administered are the mRNA vaccines. Those are the ones that are from Pfizer and Moderna. They consist of genetic material, which is called messenger RNA, that is encapsulated into a delivery media, which is a lipid nanoparticle. The vaccine uses your own body to generate what's called a spike protein, which sort of looks like the virus, which in turn stimulates the person's immune system to create antibodies. Some important things are that this is not a live virus, and these vaccines do not alter human DNA or cause genetic changes, and that's true for mom and for the baby. There are no safety concerns for use in pregnant people. The data about both of these vaccines is that it's about 94 to 95% effective in preventing infection and with a high efficacy to prevent hospitalization and or death. The most common side effects include a brief flu-like illness with mild fever after the second dose, and that's seen in about 15% of patients. And complications like anaphylaxis is very rare, with about 5 cases per 1 million doses. The additional vaccine types is the adenovirus vector vaccine, which is the Johnson & Johnson Janssen vaccine. Those are monovalent vaccines comprised of a vector with a form of the spike protein already contained within it. This is not a live virus either. The vector cannot replicate and is cleared following injection, so it does not cause infection. There's no safety concerns in pregnancy, but this vaccine type may be less effective than the messenger RNA type that we discussed earlier, but it has been shown to still be effective in preventing hospitalization. This type of vaccine is also not the preferred vaccine because there have been some concerns related to the development of blood clots for both pregnant and non-pregnant individuals. But those recommendations and concerns do not prevent it from being administered if it is the only vaccine available. The final are the protein subunit vaccines. Those are the Novavax vaccines. The vaccine contains a piece of the COVID virus spike protein with an adjuvant that helps the immune system respond. This is not a live virus either, and it does not cause infection, and it does not interact with a pregnant person or their baby's genetic material. This type of vaccine is some of the more older type of vaccine technology that we have that's been in use for 30 years. Just a little bit about the issue about blood clots that I mentioned with the J&J vaccine. The current information suggests there is a relationship, but it is a very rare complication that we see with that kind of vaccine. As I mentioned earlier, the current recommendations are for the use of the mRNA vaccines from Pfizer or Moderna for pregnancy or recently pregnant individuals. The J&J vaccine remains an option if the messenger RNA vaccine is not an option and the individual is not vaccinated. And there are no recommendations related to stopping other medications like contraceptives if the J&J vaccine is used. The booster doses are what I want to talk about next. This is something that's a little different now. The boosters are bivalent mRNA COVID vaccines are now the recommended vaccines to use for a booster for individuals, including pregnant or recently pregnant individuals age 12 or older. Currently, the Pfizer bivalent vaccine is approved for those 12 and older, with the Moderna version approved for those 18 and older. The booster is eligible if you're 2 months after the last primary dose or you're 2 months after the last monovalent booster, which was the type that we used in the past. Now, this is just some historical information I wanted to share, and I think this shows how much progress we've made over the course of the pandemic. This is information from our Children's Hospital about patients admitted to labor and delivery or the hospital who are pregnant and COVID infection. And you can see that about a year ago was when we really had a significant increase in hospitalizations. And since then, we've had a significant improvement, and we've been able to maintain that improvement, which is great. I also wanted to bring up this. This is actually recent information. As some of you may have heard, there's a lot of infection going around currently, including respiratory syncytial virus, or otherwise known as RSV, and influenza. And the last row here shows the most recent data, and you can see that we're having a significant amount of children presenting to the emergency room for RSV, a persistent amount presenting with COVID, but we're having a significant increase in flu. And I bring this up because it's also something that I want to go over, which is influenza vaccination and its importance. And I bring this information up because not only are we seeing an increase in influenza cases, but it's presenting very early this season. And this is not just true locally, but this is true around the country. This is just information about the number of positive flu cases around the United States from the Center for Disease Control. And as you can see on the right, we're seeing a significant rise in flu around the country. The majority of this is influenza A, but some of it is also influenza B. So, from the American College of Obstetricians or Gynecologists regarding influenza, influenza vaccination remains a critical component of routine obstetric care, as flu can result in a serious illness, including a higher chance of progressing to additional infections like a lung infection, which is called pneumonia, when it occurs either during pregnancy or after birth. We are currently within the beginning of the flu season, but it is, as I mentioned before, presenting a little bit faster and stronger and earlier this year. And current recommendations are for all pregnant individuals or those considering pregnancy to be vaccinated. And like the COVID vaccine, this can be given at any time during pregnancy. In terms of the vaccines themselves, there's no evidence that the thimerosal-containing vaccines cause health or developmental problems in children born to women who receive the vaccines during pregnancy, and that the CDC's Advisory Committee on Immunization Practices does not indicate a preference for what types of vaccinations to give a pregnant individual during pregnancy. Additional information regarding the flu vaccine are that if you're a pregnant person and you have a history of an egg allergy, who have experienced only hives after exposure to egg, can receive any of the recommended influenza vaccines that is otherwise appropriate. And if you have a history of an allergy that is worse than hives, the vaccine should be administered in an inpatient or outpatient observed medical setting to make sure that there are no complications. In case somebody does get the flu or they're actually exposed to somebody with the flu, just to make sure that everyone is also aware of this, patients with flu-like illness who are pregnant are candidates to receive antiretroviral medications, and I have the medications listed there. Doctors and healthcare providers should not rely just on test results to initiate treatment, and if the flu is suspected, then you can also start treatment at that time while you're waiting for a result. And additionally, there are recommendations that a person who's pregnant who is exposed to somebody with the known flu can also be given medications to try to prevent acquiring the flu if they start it shortly after they've been exposed. The last part of the talk, I just want to go over what are some challenges that New York State has identified as it relates to COVID vaccination during pregnancy. I think a lot of this information, though, is probably true for any of the vaccines that we talk about during pregnancy, whether it's COVID or whether it's flu or another vaccination. So just some background, and I won't read this in its entirety, but the New York State Perinatal Quality Collaborative conducted a survey to assess both what were the experiences of medical providers and patients during pregnancy related to COVID vaccination, and the scope of where the patients were seen could have been in either an obstetrician's office, an MFM office, which is a high-risk pregnancy doctor office, with their general medicine provider, or with family medicine, or with a midwife. So these are just some of the barriers to giving COVID vaccination that was found from like the doctor's end. And there's a lot of different things people identified that we have as challenges, whether it's storing the vaccine, staffing, whether it was issues related to patients not wanting the vaccine, were the more common reasons that were identified. And this slide was looking at the proportion of patients who were pregnant who were reported to be vaccine hesitant. And the information here just suggests that we have a lot of patients, at maybe 50% or more, who continue to be concerned about what the risks are of vaccine during pregnancy for themselves and for their baby. And it's an important thing that either as patients or as healthcare providers that we continue to reassure patients that infection with COVID or infection with flu is potentially a serious complication during pregnancy, that pregnant individuals are at higher risk for being hospitalized from either of those infections, that the risk for even more serious complications are higher for pregnant patients, and that for both COVID and the flu, that vaccination is the most important thing that we can do to help prevent hospitalizations or those other more serious complications. And these were just some of the patient-reported barriers that the study found, and I think these are just important for everybody to see. And this may reflect some of the concerns on people listening today. And if these are things that seem like concerns that you may have, I think it's important for you to bring it up with your healthcare provider, either if it's related to the COVID vaccine or the flu vaccine. So the number one concern is that the vaccine will harm their baby. The second is the lack of data about safety in pregnancy. The third is that the vaccine will harm the individual. And further down the list is that family members have hesitancy towards the vaccine, which may be influencing the patient's decision. I want to make sure that the information earlier, but I'll bring it up here again, just so that everybody hears it from me, is that there is no information that the vaccines are harmful to the baby. There is no information that the vaccines are unsafe in pregnancy. And there's no information that the vaccines will harm the pregnant person. And in fact, vaccination is actually the best tool that we have to prevent some of the complications that we see from these viruses. And in terms of the baby, there's actually some information that when we give these vaccines, that the baby gets a period of what we refer to as passive immunity, which is where the baby has the chance to get some of the protection from mom after birth. Some additional barriers that patients identified is that they perceived that they might have a low risk for COVID infection. Other patients mentioned that they don't trust the information from the healthcare system, or that COVID has not been a serious disease, or that they don't believe that the vaccination will work. All of those are understandable concerns, but I think it's continually important for providers and anyone that is seeing pregnant patients to reassure them that both COVID and flu are serious infections, and that they are ones that can cause significant complications, and that the vaccines are helpful in preventing the most serious complications of those diseases. And I bring this slide up just to sort of remind everybody that, in fact, COVID does cause complications, and one of those can be, unfortunately, death, and that the risk for death from COVID, is not the same for every person, and we see it in higher frequencies in different patient populations. And finally, sort of related to the prior slides, some of our patients that are in the most vulnerable communities remain some of the patients that remain the most hesitant about receiving a vaccination. And I think it's really important for us to continue to communicate to all of our patients and to educate them about that all of our patients are at risk for influenza and for COVID, and that any concerns we can address about the safety or about the benefits need to always be asked and answered. And this final slide is one that shows where patients are the most hesitant for vaccinations across the entire country. The blue areas are where there's less resistance to vaccination during pregnancy, and the orange areas show where there's a higher rate. And our part of the country is in an area where we definitely see more acceptance of vaccine overall, which is great. I wanted to thank everybody for your time, and I'm happy to answer a few questions. Okay. Would you like me to read them?
Yeah.
Okay. So the first question is, I'm vaccinated and boosted. I'm 6 months pregnant. If I happen to get COVID, will the risk to my baby be the same as if I weren't vaccinated? So I think, this is a really great question. Um, if you're vaccinated and boosted, then your risk is much lower than if you were not vaccinated. And the risks are getting a significant infection like pneumonia or being hospitalized. The next question is, I was vaccinated during my pregnancy. Does that mean my baby is vaccinated, or does he still need to be vaccinated? Another great question. Um, Patients that receive the vaccine, we found that they end up passing along some of their protection to the baby. It's unclear how much benefit that gives, but it definitely gives some. But it's not the same as being vaccinated. And those protective antibodies tend to go away probably no later than 6 months after birth. So it's definitely important that once a baby is eligible to be vaccinated, that those are things that you discuss with your pediatrician. But the vaccine you got during pregnancy would not be the same as vaccinating your baby. I received the J&J vaccine. Can I receive an mRNA booster, or does the booster need to be a J&J also? That's another great question. The recommendations are that if you've completed a primary series, that you are eligible for the bivalent booster. And if you had the J&J vaccine, then you've completed a primary series. So you would be eligible for the booster, and the recommended booster would be the mRNA bivalent booster from Pfizer. And I think those were all the questions today. I really appreciate everybody listening. And if there's any follow-up ones that I can answer, I'd be happy to address those too. Thanks and have a good day.